Is there a relationship between your diet and the development of acne? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute, and we are a dermatology practice specializing only in the treatment of acne. And as many of you know, we like to share our observations and our insights with acne sufferers who are trying to navigate the path toward clear skin. So we hope you find this information useful, but this is not medical advice. This is only for educational value. So can the foods you eat cause acne? So that's a question that is very commonly asked. Many of our patients ask that question. They want to know, are they eating a food that may be causing their acne breakouts or making them worse? Should they stop eating certain types of foods? This is a big topic. This is a very hot topic. There are a lot of research studies going on over the past 10 years or so. It's really become a very hot topic in dermatology. So what are the facts? What's the truth? Can a change in diet cause acne? Are certain foods more prone to cause acne breakouts? So first I'll go through the information that's available at this point, and then I'll tell you my take on it. And I'll tell you what I think the results mean and how we can incorporate them or not incorporate them. So one of the things that prompted people to consider the fact that maybe diet is playing a role in causing acne was the fact that observations were made of certain populations that ate indigenous diets that were very low in sugar and very healthy diets from foraging and eating things that were very different from what the Western diet incorporates. So no alcohol, no sugary foods, no processed foods. So those are all things that we typically are exposed to in a Western diet. And the observation was that maybe these populations that were eating more natural organic diets, maybe they had less acne. And that's what the observation showed, that they didn't seem to really be at risk of having acne. But it's hard to go from an observation like that to make a blanket statement that if you eat a Western diet, you're going to have acne. Because clearly not everyone eating a Western diet develops acne. And there is a lot more to it than making that blanket conclusion. So let's look at the studies. So there are two main foods that we typically look at that have garnered a lot of attention lately. One of them is dairy consumption. The other one is sugary foods. So those are the two main food groups that occupy a lot of attention when it comes to looking at whether acne is influenced by diet. And then there are a couple different kinds of studies that are typically done. One of them is a recall study where investigations are done of people who remember what they ate over a certain period of time, and they try to recall that to the best of their ability. So those types of studies are not very definitive, but nevertheless, those are frequently done. And then another type of study is an interventional study where changes are made as the study proceeds. In other words, certain foods are restricted in one group and not restricted in another group, and then that helps us to make some inferences at the conclusion of that type of study. So we have those two main kinds of studies that are done. If we look at the results of those studies, we understand a couple things. Number one, it's very difficult to do those kinds of studies because there are so many things that can influence whether acne is getting worse or better. So there are a lot of lifestyle factors that could play a role: smoking, alcohol consumption, stress, occupation, a lot of different things that could play a role in whether acne gets better or worse over a given period of time. So those are always things to keep in the back of your mind when you're interpreting the results of these kinds of studies. Also, dietary interventions are not always that clear cut. It's very hard for a person to be very consistent with certain dietary restrictions over a period of time. So you have to consider that as well when interpreting these types of studies. But let's look at the information that was obtained. So there are lots of different kinds of foods that have been looked at, and there are a lot of different conclusions of different studies. So there's really no definitive conclusion for a lot of the questions that were asked. So, for example, one study can say that watermelon is protective against acne, and another study might say that corn causes acne. So there are a lot of different proclamations from these different studies that you really can't dig your heels into, and you really can't say for sure that those are the true facts. So let's turn our attention to the two main food groups that are thought of the most when it comes to diet and acne. So we have dairy products and we have foods with a lot of sugar content. So let's take the sugar content foods first. So when it comes to sugar in food, we have something that we use called the glycemic index. So the glycemic index is really just a comparison tool. So we take glucose, if somebody consumes pure glucose, which is sugar, pure sugar, and then we measure the amount that enters the bloodstream after it's ingested, we compare that to other foods, because each food has a certain rate that it's going to release glucose into the bloodstream. Now, the foods that release a lot of glucose or sugar into the bloodstream very quickly and rapidly are considered to be high glycemic index foods. So they are closer to the way pure sugar would act. Whereas foods that are more slow to release their sugar content into the bloodstream have a lower glycemic index. So processed foods or heated foods, foods that are broken down before you eat them, those foods tend to liberate sugar into the bloodstream more readily than foods that are more complicated, and they require a lot more processing by your body to extract the sugar content. So raw foods and foods that are not processed would be along those lines. So it turns out that if you restrict the foods that release sugar quickly into the bloodstream after you eat them, and you concentrate on foods that are more slow to do that and require the body to break down the foods after you eat them, rather than breaking the foods down by processing before you eat them, then you can start to look at some of the information that we obtained related to acne. And in some studies, we seem to see that people tend to have more acne measured when they tend to consume foods that have that quick release of sugar into their bloodstream. So those high glycemic foods, those foods are the ones that we tend to think about as not friendly for acne, the ones that potentially can make acne worse. And the foods that are more raw and unprocessed, those foods tend to be less likely to cause acne to get worse. Now, what does that really mean? So in one report, for example, dividing subjects into those that were kept on a low glycemic index diet, so that the foods didn't release a lot of sugar quickly into the bloodstream, compared to those who were on an unrestricted diet, the people on the restricted diet tended to have less acne. Their acne tended to improve. Now, it improved by not a whole lot, but the results show that maybe there is something going on that's significant as far as foods that freely release sugar into the bloodstream very quickly, and those causing acne to get worse. So we'll talk about what that means in a minute. But before we do that, let's turn our attention to dairy products. So dairy products are another one of those that everybody talks about. A lot of my patients want to know, should I stop eating milk or cheese? Do I eliminate dairy from my diet? Is it making my acne worse? And the answer is less obvious for dairy. So for dairy products, the studies are not that conclusive. We really can't draw an inference from the studies at this time. It's very difficult because the studies are showing a lot of different results or suggesting a lot of different outcomes that sometimes are contradictory. They're not really well controlled. We can't really draw a conclusion from a lot of the information that comes from these studies. So we have sugary foods with a high glycemic index, and we have dairy products. So the dairy doesn't seem to be much there that we can hold on to, and nothing that we can really conclude at this time. The glycemic index, the ones that have a high glycemic index, those foods we tend to feel a little bit more comfortable saying there might be something there that could be affecting acne in a negative way. So perhaps reducing those factors in your diet might be helpful. Now, 2 points. One, your skin is an organ just like your heart, your kidneys, your liver. Your skin is an organ that also benefits from healthy eating. So you should always try to optimize your diet for your body overall anyway. So your skin's going to benefit if you have a healthy diet, if you consume a healthy diet. So it makes total sense to focus on a diet that has a lower glycemic index, one that doesn't release a lot of sugar, have a sugar burst into your bloodstream after you consume it, because that's not necessarily the healthiest type of food to consume for a lot of reasons, not just related to the skin or related to acne. So it's a great idea to try and limit your dietary consumption of high glycemic foods anyway. Now, that's one point. It may benefit your acne, but the next point is, will it make a big difference? And so that depends on each individual's interpretation, because from the studies, it doesn't look like it's a black and white answer. In other words, we don't see any studies that show if you restrict your diet to low glycemic index foods, then all of a sudden your acne is going to disappear. So we don't see those studies. We don't see results showing that. What we do see is we see results that are much less obvious. The results, at least in some of the studies, tend to show improvement by restricting the glycemic index, but the improvement is not a very, very high level of improvement. So for example, in the 15% range, the 20 to 30% range might be what we can expect under optimal circumstances. And the question is that enough to influence your acne? So let's think about that. Let's say you have 100 breakouts on your face and you consume a diet that makes you 25% better. So now you have 75 breakouts on your face. So did you do something meaningful, or is that something that didn't go far enough? So that's a question. And it could be different for each person. Some people only want to have a certain amount of improvement, and then they're going to be happy with that. Other people are seeking completely clear skin. So for those seeking completely clear skin, dietary modification by itself is probably not going to give you the solution that you're looking for. And interestingly, that's similar. You can think of the same thing with a lot of the acne prescriptions that are available. So many of the prescription acne treatments, they don't give clear skin. If you look at the data, they can give also certain degrees of improvement, 30%, 40%, 50%. And the question is also for those, is that what you're looking for? Or do you want something that has a higher chance of giving you completely clear skin? So these are questions that you need to discuss with your provider when it comes to diet, when it comes to prescription medicines, because it's all kind of the same idea that each modification, each change that you make, whether it's taking a medicine or changing your diet or changing your stress level, all of these things can impact acne in different ways and to different degrees. And so obviously you want to optimize all of those departments, but it gives you a perspective as far as when you're looking for a solution that's going to potentially give you completely clear skin, then those things are important to discuss with your doctor to see which ones are going to contribute the most, which ones are practical for you to do, and what direction you want to proceed in order to achieve your goal.